Guys, I do apologize. I was chatting away to myself there and realized that my microphone was on mute. So apologies. You'll know me again. Welcome. Andy is my name. If you have any questions, guys, just click the comments, pop into the comment section there. If you're new to the channel, please do subscribe or hit the bell notification. So sometimes people will say, I don't always get the notification. There won't be a notification every week. So do click the subscribe button. We go live the same time every week, so it's easy to remember. 11 o'clock in the morning, it'll either be myself or Chloe, and 7:30 in the evening every single Thursday, and we'll never miss that. So 11 a.m., 7:30 p.m. Just turn up, it'll be the same time all the time. Today, we're going to be talking about something entirely different. And again, apologies for the silence for a couple of minutes. We're going to be talking about non-alcoholic fatty liver disease. So fatty liver disease, really important to know about, hugely important, because the vast majority of people who have diabetes have it. It's actually 90% of people with diabetes have it. But it will be, at least half of the time, it'll be undiagnosed because very difficult to, it lies silent for a long time. It's dormant for a long time. It's often asymptomatic. There's no symptoms. But it's the most common form of liver disease. It's also the second most common reason for liver transplants. So it's just about to catch up with alcoholism. Alcoholism is currently the leading cause of liver transplants, closely followed now by basically overconsumption of processed carbohydrate and sugar, so processed food. And it's the leading predisposing risk factor for primary liver cancer. So what's really interesting here is that you can't see it in a blood test. You can see indications of it, but the majority of people with non-alcoholic fatty liver disease have normal liver blood work. So the doctor might say, oh, your liver enzymes seem fine, but have a look at this. This is the percentage of people who have fatty liver disease. In general population, it's 40% of adults. If you're overweight or obese, it's 60% of people. If you're type 2 diabetic, there's a 90% chance you're diabetic. And like a famous researcher in the area said, 90% of people with diabetes have fatty liver disease, and the other 10% haven't found out yet. So if you have type 2, chances are you have a fatty liver. And don't worry, there's nothing to panic about, because fatty liver will be reversed within 6 or 8 weeks of following a low-carb or ketogenic diet. Now, really interesting study in Germany looked at overweight children. 30%, 1 in 3 almost, of kids who were overweight in that German school, they were only 8 or 9 years of age, had non-alcoholic fatty liver disease. So why should we worry about this? Well, we should worry about it because it is an independent risk factor for cardiovascular disease, meaning even if you're not overweight, you don't have high blood pressure, you're not type 2, you don't have any of the other risk factors like high cholesterol or dyslipidemia, I should say, it's still an independent risk factor, a huge risk factor for heart disease. So most people with fatty liver disease die from heart disease. So as we look at diet, so it's not alcohol, because the diagnosis of non-alcoholic fatty liver disease is pretty straightforward. And actually, just to talk a little bit about what fatty liver disease is, it's a buildup of intrahepatic triglycerides, which is a fancy way of saying fats in your liver. So triglycerides, they're just fat molecules essentially. And when you get a certain amount of your liver is showing fat in it, it goes beyond a certain percentage, you're then deemed to have fatty liver. If you drink a lot of alcohol, they call it alcoholic fatty liver disease. If you don't, and you're below the threshold for the amount of units that would be deemed alcoholic fatty liver, it's called non-alcoholic fatty liver disease. So essentially, they're exactly the same disease. One is caused by alcohol, the other is caused by diet. So if we were to look at the dietary drivers of non-alcoholic fatty liver disease, who would you suspect is causing the buildup of fat in the liver? Is it eggs, butter, cream, fatty meats? Is it rice, pasta, bread, potatoes, those sort of foods? Or is it fruits like bananas, grapes, and pineapple? Well, I would have thought before getting deep into this kind of research on metabolic health, it would seem pretty obvious. You know, you should say, well, there's fat in the liver. So it would stand to reason that the cause of that is probably fat in the diet. So let's take a look at what the research says. So if we look at this paper from Donnelly et al., and this is going back to, I think it was back to 2011, if I remember correctly. It's a good while back anyway. But they looked at the sources of fat stored in the liver. So you can do this with a thing called radioactive tracing. So you eat, for example, carbohydrates, and you see when you follow that food type by tracing it, how much of it ends up with fat in the liver. You eat fat, you eat fructose, which is fruit sugar, and so on. So 15% of the fat that ends up in your liver comes from dietary fat itself. 59% is caused by lipolysis of adipocytes, which is a fancy way of saying fattening of the fat cells, which happens because of insulin, so by carbohydrates. So almost 60% of the fat in your liver is caused by carbohydrates. 26% are caused by fructose, which is fruit sugar, or, in the form of what's it called, high fructose corn syrup and fizzy drinks and things like that. And only 15% was caused by dietary fat. So somewhere between 75 and 85% of liver fat is driven by insulin and carbs, not dietary fat. So again, up to 85% is caused by rice, pasta, grains, all that sort of stuff. And the other fat in the liver will come from fruit. So high fructose corn syrup and fruit and carbohydrates, not dietary fat. So we've had a scenario a couple of times where somebody's hepatologist will be talking, hepatologist, just liver specialist, will be talking to them and they'll say, God, you've lost weight. And they'll say, oh, I'm on this diet. And what are you eating? What sort of a diet is? And the patient will say, well, I eat eggs and strawberries and cream and fatty meats. And the hepatologist, if they're less versed on metabolic health, will say, God, that doesn't sound good at all for your fatty liver. In fact, I'm not happy with that at all. And of course, the patient goes back a couple of months later and they no longer have a fatty liver and they don't need a hepatologist. And this is the reason why. So ironically, it's not fat that causes a fatty liver. And funnily enough, the number one thing you should eat is fat if you have a fatty liver. So it's totally counterintuitive, but that's what the science says. That's what bears out in the clinical literature. I meant to say, guys, if anyone has a question, pop it into the comments box, say hello, ask a question. The question could be about anything. This is an open forum. We cover different topics, but it can be about weight loss, type 2 diabetes, polycystic ovarian syndrome, fatty liver, like we're talking about now, anything at all, Alzheimer's, Parkinson's, dementia, any question you have, let me know. More than happy to answer any questions. Okay. So this brings us back to the point that as we look at foods, we want to choose foods that don't spike our blood sugar levels. So the foods that spike our blood sugar levels are refined carbohydrates like bread, rice, pasta, granola bars, frozen pizzas, all that sort of stuff, cakes, scones. The ones we want to avoid are those for sure, because there's two different mechanisms whereby they will cause liver fat. One is refined carbohydrates. Refined carbohydrates cause the intrahepatic buildup of triglycerides, the fattening of your liver through the action, or under the action, I should say, of insulin. And the other one is the de novo lipogenesis, or fat storage, that will happen from fruit. So we certainly want to avoid fruit. Now, this is interesting. So a lot of people think, well, fruit is healthy, therefore I'm going to eat loads of fruit. That's not a good idea if you're diabetic at all. So you definitely want to avoid full sugar Coke and full sugar fizzy drinks like Fanta and Lucozade and so on, because they tend to contain high fructose corn syrup, and that's a lot of processed food has that. That's a disaster for your liver. The other thing that's bad for your liver actually is fruit. So fruit, without a shadow of a doubt, is bad for diabetes. Without a shadow of a doubt. There can be no question around this anymore. And people who tell you that fruit is good for you, and if you're diabetic, you should eat fruit, are yet to do their homework on metabolic health, because the papers and the mechanisms are very clear since about 2015, 2016. When was this paper actually? 2015, yeah. And this paper actually was, if you look at the title of it, Carbohydrate Intake and Non-Alcoholic Fatty Liver Disease, Fructose as a Weapon of Mass Destruction. So that's from Hepatobiliary Surgery of Nutrition. So it's a famous paper in liver health. So we now understand that fructose, which is fruit sugar, is metabolized directly by the liver. So glucose, which is carbohydrates broken down, causes your blood sugar levels to go up, which is obviously really bad if you're diabetic. Fruit does the same, but not to the same degree. It's actually way worse. What it does is it goes straight down to the liver and causes a further buildup of fat in the liver, which is bad for fatty liver and even worse for diabetes. So that's why we want to be careful with fruit. And this is a paper from a few years, actually a good few years back, which really put the nail in the coffin around which is better for for fatty liver, low carb or low fat. So this is looking at two different interventions. So basically the group of 100 people split into 50 on either side. They put one group of 50 on a low carb diet, the other group on a low fat diet. Interestingly, the weight loss was around the same, on the same amount of calories. But the liver fat reduction in the low fat group when they lost weight was 28%. In the low carb group in green, it was almost 60%. It was almost double. So double the weight loss. So they were eating more fat. In the group where they were eating more fat, they were on a low carb, high fat diet. There was double the fat loss in the liver. So way more effective for non-alcoholic fatty liver disease. Okay, so this is worth looking at. Now, this advice is also relevant if you're looking to lose weight, lower your blood pressure, optimize your cholesterol levels, treat polycystic ovarian syndrome, prevent Alzheimer's, prevent cancer, all of those sort of things. But it's also relevant for fatty liver. The mechanisms are all pretty similar. High blood sugar levels is at the root cause of all of those. So what's something known as hyperglycemia or hyperinsulinemia. So breads, including white whole grain breads, rice and pasta, whether it's white colored or brown, doesn't make much of a difference. Breakfast cereals, including granolas and porridge and oatmeal, if any of our guys from Canada are listening in, eliminate those from your diet, guys. Fizzy drinks, the artificially sweetened fizzy drinks are okay. They're not the end of the world. So it's technically correct to say that they are bad for you. Things like aspartame, aspartame acid, sucralose, they're not great, those artificial sweeteners, but they are definitely better than the full sugar counterparts. Cakes and pastries, a couple of people saying hello. Hi Jacinta, hi Brian. Thanks for your comments. Brian, do me a favor if you don't mind and pop in how you did on the program just to inspire others. I know it was something super impressive, but just if you don't mind, just let me know. Or just let the guys know, because it's always good when people see how other people did on the program. And thank you. Foods that you would use to treat non-alcoholic fatty liver disease. Again, all the same basics. There's a really good acronym that's worth remembering that'll help you remember these, and it's MEALS, 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 which stands for the foods you should eat for reversing diabetes and optimizing your metabolic health. So M stands for meats or fish, any. E stands for eggs. A stands for added fats, which you want on a low carb or ketogenic diet. So added fats would be things like olive oil, butter, avocados, chia seeds, all of those sort of things. So MEAL, L, low sugar fruits and vegetables, and S for snack on dark chocolate and cheese. So that's just an acronym that I find handy to say to patients. MEALS. Meat or fish, E for eggs, A for added fats, L for low sugar fruits and vegetables, and S for snack on dark chocolate and cheese. Okay, so these are the foods. So meats, again, fish and seafood, cheese. Dairy, as a general rule, should be full fat. So things like Greek yogurt, cheese should all be full fat and low sugar. Green vegetables, and as a general rule, any vegetables that grow above the ground are good. So try and go for them. Comment from Anya Maria. Hi, Anya Maria. How are you? How are you doing? Thanks for saying hi. Eggs. And by the way, eggs categorically will not adversely affect your cholesterol levels. The idea that because eggs contain cholesterol, they'll give you quote unquote high cholesterol is nonsense. It's not true. Avocados, all those sort of real good fats. Real butter. So your kind of Kerrygold type butters, they're super. Or any real creamery butter. And olive oil is particularly good. Olive oil actually has a kind of a pharmaceutical, or to use the correct term, a nutraceutical type of effect on fatty liver disease. So there's a unique kind of thing that happens when you have olive oil if you have a fatty liver. So I would definitely include olive oil. But you can make the argument it's not a good idea to cook with olive oil because it's not all that stable from a temperature point of view. So the smoke point is pretty low, meaning if you put olive oil on a hot pan, you notice it smokes. And when something smokes, that means that it's changed its chemical composition and gone a little bit rancid. So I like to cook. Personally, I cook everything in beef tallow, which is hard enough to get, funnily enough. It was the thing that everyone cooked in, including in chippers. If you went into a chipper, they used to cook everything in lard, and they just recycled the lard, animal lard. And now it's all crappy vegetable oils that are really bad for your heart. So that's what I choose to cook with. Jacinta, hi Andy, you'll be happy to hear on Tuesday night I had lost 8 pounds in the weigh-in. Magic. Great, Jacinta. That's a superstar. Well done. I am delighted. Okay, here's a good example of a case study. This is somebody who had non-alcoholic steatohepatitis, which is a progressed version of fatty liver disease. And you can see here his HbA1c, his weight loss, first of all, was about 16 kilograms, which is a lot of weight. HbA1c, that's the 120-day marker of your blood sugar control. If you don't know your HbA1c, make sure you ring your doctor and find it out. It's the only number that matters, because your blood sugar levels will give you an indication of what your HbA1c is going to be. But your HbA1c is the gold standard. So you definitely want to know your HbA1c and keep an eye on it. ALT just stands for serum alanine transaminase. It's another liver marker. His ALT went from completely out of range at 82 back to normal at 43. And his GGT, gamma glutamate transferase, another liver enzyme, went from 184 down to 96, 49% reductions. Guys, if you could find a drug that would do this, I'm not joking you, it would make billions. This was in 16 weeks. Absolutely, it would be a blockbuster drug. You'd have generational wealth for whoever came up with it. But there is no drug that can do this. There never will be, because fatty liver is caused, non-alcoholic fatty liver is caused by carbohydrate metabolism dysfunction. The only solution is to reduce your carbohydrate intake. Okay, comments coming in here. Another one from Hugh. How are you, Hugh? It's my first time away since I started the program. I've done very well, but I'm a bit concerned how to behave when I'm on holiday. Okay, no need to be concerned. Just behave. What I would say about that, Hugh, is do your best, but actually do your best. I don't mean like, we'll see what happens and we'll do our best kind of a thing, and whatever comes my way comes my way. I always say when I'm going away that the advice I give to my own patients when I'm coaching them is always intent is massively important. And what I mean by that is, if you say, I've had people say this to me before, and I always pull them up on it because I should. It's my job to do it as a coach. They'll say, I'm going away for a stag now at the weekend, or I'm going to a wedding at the weekend. So look, that's going to be a disaster anyway. And I'll always say to them, well, are you asking me for permission to put on 2 or 3 pounds and have high blood sugar levels? And they'll say, no, I'm just saying the wedding will be a disaster. And I say to them, well, you're not. What you're doing is you're phrasing it in such a way that you're asking for permission to make it a disaster. That's what you're doing by saying that. So if you go in with the wrong mindset, and that's not what I'm saying you're doing, but if you do go in with the wrong mindset and you say, oh God, I'm kind of concerned as to how I'm going to get by on holidays, I always say to my patients, tell me about the restaurants you're going to that don't have meat, eggs, cheese, fruits, and vegetables. Because if you want to make it work, you absolutely can. And type 2 is a really, really, really serious condition. So I'll give you an example. We had a patient on a clinical trial who'll remain nameless, obviously, for obvious reasons. And this is how serious type 2 is, who didn't want to comply with the diet, just kind of said, I think it'll be too hard not being able to eat bread. And a couple of months later lost his foot. And this is the reality that we're dealing with. When you eat carbohydrates, sugar and carbohydrates, your blood sugar levels go over 8, you are causing small blood vessel damage that can lead to amputations, stroke, cancer, all sorts of scary stuff. If you knew that was coming and you could prevent it by staying on track, you wouldn't be long staying on track. So you can do it if you decide you're going to do it. And I'm not the type of person to sit here and say, it can be done to go away and stick to your diet. We all live this way. So Chloe, for example, sent me, I won't share because I don't have permission, but she's going away to a festival at the weekend. Chloe's one of our health coaches. And she sent me a picture saying keto festival prep because she's going to a festival. Let me just show you this because this is really impressive. If it'll focus, and I'm sure she won't mind me showing this, but this is all her prep. She had boiled eggs, she had chicken ready. She had loads of stuff like beef-free, low-carb wraps brought with her, raspberries, almond milk. She had everything ready to go to a festival where she knew she'd have no food for the weekend. So it can be done. It absolutely can be done if your mind is in the right place. I was away with the kids camping a couple of weeks ago. We brought low-carb, gluten-free sausages, eggs, rashers, and cooked on a kind of a camping stove thing. So it can be done. If you're going to restaurants, there is no restaurant. And actually abroad, funnily enough, you're almost better able to manage it, because I was over in Portugal 2 or 3 years ago. I was eating olives, cheese, chicken Caesar salads, loads of stuff. Seafood chowder, steaks with side salads. It's nearly easier to do it abroad. But so it can be done. If you put your mind to it, it can be done. Having said that, if you get yourself into a corner and you're in a scenario, for example, you're over at a friend's house and they bring out lasagna and you don't want to sit there starving and go, I don't eat lasagna, cook something different for me, which I don't expect anyone to do. Then you have to resign yourself to the fact that I did everything I can. But it can be done. Brian, oh good man, thank you, Brian. I was diabetic for about 8 years and way overweight. I was on 4 Metacam pills and candesartan, so Metacam diabetes and candesartan blood pressure. I joined the program 2 years ago, and within about 18 months, I had lost 5 stone, and oh, that's annoying. I think we're probably waiting for the second part of it. 5 stone, that's insane. Unbelievable. And I think your blood pressure went back to normal, if I remember correctly, and you're no longer diabetic. Jacinta, what happens if your sugars go down to 1? What can you help to bring it back up again? Sugar and in a hurry, Jacinta. So if your sugars go down to 1, usually that's a sign, that can be a sign that your medication level is too high and it's pushing your sugars down. They shouldn't go down to 1, but if it does, there's 2 things that cause low blood sugar levels. One is over medicating, and the other one is your blood sugar levels going high first. So if your sugars go really high, your body can counteract that by driving them down. It's called an overcorrection. So if it does happen, the thing to do is stay low carb as often as you can, because if you stay low carb, you minimize. If you have small numbers, it's very hard to end up with a low. So it's a game of big numbers. If you go up to 15, you're much more likely to come down to 1. If you go up to 6, you're much more likely to come down to 5. That's how the blood sugar roller coaster, as they call it, works. Number one thing, first and foremost, keep yourself safe. Some patients say to me, oh, I didn't want to disappoint you by having some Coke or having some chocolate, or have Coke, do whatever it takes to get your sugars back up, because 1 is dangerously low. Have anything sugary, like a drink of Lucozade or a half a can of Coke or something like that, whatever it takes to get your sugars back up safely. But as time goes by, as you keep following a low carb diet and you get better blood sugar control, the amount of lows you have should be minimized. So hopefully that won't happen too much more often. Okay, I think that's it, guys. I just wanted to do a quick one this evening on fatty liver. It's an interesting topic, and all of the advice I've talked about food-wise in terms of what to eat and what to avoid is relevant for type 2 diabetes. Thanks for joining us. Remember, guys, we're live by the way, if you haven't subscribed, please hit the subscribe button there, and then just hit the little bell notification, so you'll get a notification when we go live. We always go live at the same time. I wanted to finish off Brian's story. After losing 5 stone, his diabetic nurse stopped all his meds. This is due to diet and watching sugar and carbs on the packets of food. That's why I love this job. Thanks, Brian. Guys, have a good week. I really appreciate you listening to me. Remember, we're always live at 11 o'clock on Thursday morning. It'll either be me or Chloe. And Thursday evenings, then it'll usually be me, but we'll have guests on, and Chloe will be presenting occasionally as well. I really appreciate you taking out the time to listen to me, guys. And we'll see you next week. Take care, everyone. Bye-bye.